Disclosure. I've talked about PTSD and anxiety from a first responder's point of view, what it looks like, how it is, how I deal with it, how I've dealt with it in an unhealthy behavior, and how I'm trying to deal with it in a healthy behavior and grow from it to be a stronger, better person. So I'm going to disclose some information to you about an extremely traumatic event that involves the death of a child, involved with a secondary to a drowning. And if you don't think you can handle listening to something like that, then you stop the video, because I'm going to disclose it to you the way I feel from what I've been taught about disclosing these traumatic events and what worked for me. I don't know if it'll work for you, but the more you disclose, the more weight that you're taking out, and the more details. Now, I've started this video like 15 times, but it's been just stressful to even start it. Even though I've disclosed this information, I don't really quite have it mastered yet to be able to discuss it without any kind of stress. So this happened over a decade ago, but it still causes me a lot of stress, and I've had nightmares for years involving this particular situation, and this is just one of several. So I want to disclose this situation to you because this is something that I have more recently per se have disclosed, and it is it's helped me become a healthier person. So anyway, so here it goes. So disclosure, right? So starts out this child. I'm just gonna, okay. So there's this child that drowned, and they were pretty young. And at the time that it happened, they were alone, which has created more stress for me, knowing that they were by themselves when this happened. And they were in the water, and they've been underwater for an unknown amount of time. The end result looked like it was going to be a great one, and I'm standing over this child in the ER with the doctor and another doctor and a team of nurses and pediatric and respiratory, and everybody's there. It's a group effort, and you look on the monitor and you can see that there is a rhythm that is back. The child's still cold. It was winter time, and it was a cold water drowning, which is great, because if you do have a drowning, cold water kind of helps preserve and you have better outcomes. So the fact that the rhythm is back now from asystole, which is flatline, now there is a rhythm that's back, and it has some pauses in it, but it is an organized rhythm. Things are looking good, and so it's okay. So I find myself doing CPR, and as I'm doing CPR, the doctor tells me to stop so we can do another rhythm check, pulse check. There's an IV established. The child's intubated, respiratory is breathing for the child. They're breathing too fast. If you know anything about breathing, there's a certain amount of amount of breath that's valuable, and it becomes you know, if you don't breathe enough, it's not good. If you breathe too much, it's not good either. And they were breathing too fast, and though it's not my place because I'm not respiratory, when you're dealing with in that situation, everybody works together as a team. I said something to respiratory, they slowed down. The doctor tells me to stop doing CPR so they can do a pulse check, rhythm check. I said we had a rhythm, but with that rhythm, you also, if it's under 60 beats a minute, you can continue to do the CPR, continue to do the compressions. I say CPR, you're not doing, the breathing is, they're intubated, so it's continuous breathing every so many seconds. I'm doing the compressions, and then he likes to stop the compressions, try some different medications to speed the heart up, elected not to warm the child. There's like a warming type blanket to put on the child. The doctor elected not to do that. And I found myself feeling somewhat excited that we're getting this child back, that this child has another opportunity to live their life and a second chance. Well, we lost the pulse, and I say we lost it. It became more of an unorganized rhythm, and we start CPR back up, because with the medication given, the heart rate sped up for a little bit, then it fell back off. We start CPR back up, and me and another guy were switching off on doing the CPR, and so we are all involved with the care, and everybody's working together as a team. But I didn't agree that the doctor shouldn't warm the patient, because they still had a low body temperature, still hypothermic body temperature. And for whatever reason, he's the doctor, I'm paramedic. There's the nurses in the room and respiratory's in the room, but you have to work together as a team, but respect what the doctor is saying, because he should know more than everybody else. But here's the thing is, we all make mistakes. And so just like respiratory made a mistake, and they were appreciative of what I was saying and slowed down. Now, they didn't say, hey, thank you, but they had a little bit of an excuse of why they were going that fast, but they immediately adjusted, and everybody in the room agreed the adjustment to go slower. Now we're doing CPR again, and I'm back to doing CPR, and the doctor tells me to stop so they can do another pulse check and see what the rhythm is. And when we do, it's back. It's about 30 or 40 beats a minute, and he tells me to stop CPR. And then he says, I'm going to call it. Does anybody have a problem with me calling it? And nobody in the room said anything. And so I said, I do. I don't think we should stop. I don't know why we would stop. And this doctor looked a little disgruntled, and basically asking, hey, anybody else think we should keep going? And a couple of the doctors were talking amongst themselves, pediatric, and the main ER doctor is talking, and there's another doctor in the room, and I went over to him and said, hey, if this patient was still in the back of the ambulance with me, I would be doing CPR right now. There's still a rhythm. The patient's heart is still breathing. She's not breathing on her own. The heart's still beating. She's not breathing on her own, but her heart is still trying to work. Why would we call it? Why would we stop? Why are we stopping compressions? And he looked at me and nodded his head, and he turned to the other doctor and said, we need to start compressions back. There's no reason for us to be stopping compressions. It's under 60, ACLS, AHA guidelines says we should keep going. So we continue to go. A nurse steps up and says, we need to put the blanket on. He starts getting out the warming blanket, and he says, no, keep that off of her. We don't need to do that. And so I don't know why he did that. But we go back to compressions, and me and another guy are trading off on doing the compressions. He does a little bit more medication, and then he eventually says he wants to call it again. And nobody in the room argues with him. And at this time, I'm doing CPR, and I tell him I don't think we should stop. And He says, let's stop and do a pulse check. Stop. He says, I don't feel a pulse. And I look at the monitor, and the monitor still has a rhythm on it. And though there's pauses where they're flatline, asystole, you have an organized rhythm that comes up 4, 5, 6, 8 beats at a time of a nice organized rhythm, of a sinus rhythm, which is what a healthy heart beats on. And then it kind of gets into a junctional, some PVCs are popping in there, and then sinus back, and then a pause, sinus pause, and it's flat line, and then it comes back. And so that's what we see. And we start CPR back up, and he tells me to stop. He says, I'm calling it. There's nothing we can do. Patient's gone. He's looking in her pupils. Pupils are dilated. He says, oh, they're fixed and dilated. Well, some of the medication you give makes the pupils fixed and dilated. But death also makes the pupils fixed and dilated. So is it fixed and dilated from the death, or is it fixed and dilated from the medication? Who's he? He's not God. He doesn't know the possibilities of what could come out of this. He says we need to stop. So he says to stop. I keep going. Everybody stops. The nurses that were next to the patient back away. The nurse on the end holding that blanket backed up. Pediatric. Just kind of nod their head that they agreed. Respiratory is right here, and they set the bag down, and the bag there, the BVM. They set the BVM down, and I was standing right here on, to the patient's right, and I was still doing compressions. And they tell me to stop. Now, you want to feel stress? To me, knowing that child's heart is still beating, and they say that the hearing's the last to go. And being in that room, and her family was not there yet, being surrounded by strangers and cold, and the CPR is keeping the heart and the pumping, the heart's pumping on its own intermittently, and then the compressions are helping to continue to have blood moving, and to keep to see everybody step away from an innocent, beautiful little child. Just left tremendous feelings of hopelessness in me, and frustration and anger, and I continued to do CPR. And after a few times of them telling me to stop, I stopped. To this day, I regret stopping. I regret not being more aggressive in the treatment. I regret not rallying the people that were in the room who seemed fearful of this doctor to be more supportive. I felt hopeless and shameful. And the guilt that weighed on me in that moment was tremendous. I mean, I was the last person to help her survive, and I stopped. everybody left the room. Everybody walked out and everybody left the room. The doctor was one of the first people to walk out, followed by the other doctors and nurses. And I stayed in there, and almost immediately a nurse came back in and turned the monitor off. Now when the monitor was turned off, it really, brought the conclusion that it was over, game over. But I know that she was still there. I feel now, I'm not God either, so I don't know. All I can tell you about is just the instinct of what was happening in my head at the moment, and what I saw on the monitor, and body temperature and heart rate. If we should have stopped or not, I still to this day don't agree that we should have. All I know is that what I've learned is that that it happened. It's not what's wrong, it's what happened, is what they say. That's not what they say at the hospital. It's what they say about post-traumatic growth. And when you're looking back, it's not what's wrong, it's what happened. Wrong or right, it just happened, and there's nothing you can do about it. And there's nothing I can do about that moment, but the future changed dramatic for me. And I stayed in that room with that child. Get back to disclosing how this made me feel. I stayed in the room with that child, and they came in, turned the monitor off, and then they turned all the lights off except for the one right over the bed, and there's no windows in there, so it kind of made it a little bit darker, a little more comfortable setting. And I stood there and held her hand, and talked to her and prayed with her and told her that I was sorry. Told her that she didn't have to worry. That it wasn't her fault. Covered her up. As far as, I tucked her in so she'd be comfortable. Just like I would tuck my own kids in bed at night. Closed her eyes. And in that moment, I feel I presented calm and strong and tried to be a supportive voice, and I wasn't upset, but inside it was rough. And after I stood next to her for a while and praying with her and holding her hand and talking to her, when I felt like she really was gone, I walked out of that room putting a very large weight in my bag. You know, discussing this backpack or your rucksack, and you just keep adding things to it. And though that call gave me a appreciation of life and family and kids, and drove me to be a better advocate for my patients, be a better firefighter, better paramedic, study harder, work harder, have a healthy diet, work out more, and be physically fit to not be too tired to face any kind of whatever it was, that I wasn't going to let somebody down like that again. And I buried it down deep inside, and it would affect me when I was around water and kids, along with some others. And when too much weight got carried on me, the nightmares from that call increased. The feelings and regret, and like I said, the shame and the guilt and the hopelessness, it was tremendous. It's been over a decade ago, and I've disclosed this story a few times, and the first time I did, I was just a complete mess. But you know what, when I did, some of the nightmares revolving it slowed down. And all the great things, because there's got to be good that comes out of everything, I saw some great things that came out of it. You know, the appreciation for life itself, the drive that I had to learn more and to be a better person. You know, those were great things that came out of that just extremely horrible situation. And last year I made myself last year I made my way to the gravesite for the first time in all these years. And when I went there, I mean, it literally dropped me to my knees. And there's a picture on the headstone. And, you know, I hadn't seen them since I walked out of the ER room that night. But I mean, it was exactly, you know, it was exactly the same. You think maybe things would get manipulated or changed over time, but maybe you wouldn't remember it quite right. But there was times that that face would be projected on somebody else playing by water, and over the years, and you know, it made me a better person in some aspects, and it also caused tremendous stress. So anyway, I'm just going to say that is that's an example of disclosure.